Hello everyone. Welcome to my channel Random Knowledge Official. I hope you are having a wonderful day. Before moving forward, please do subscribe my channel and press the bell icon. Today we will see about long-term symptoms, complications of COVID-19 and few cases where people face long-term effects. People only take before COVID symptoms and health issues during COVID seriously, but they neglect post-COVID effect. COVID-19 symptoms can sometimes persist for months. The virus can damage the lungs, heart and brain, which increases the risk of long-term health problems. Most people who have COVID-19 recover completely within a few weeks. But some people, even those who had mild versions of the disease, continue to experience symptoms after their initial recovery. These people sometimes describe themselves as long haulers, and the condition has been called post-COVID-19 syndrome or long COVID-19. Older people and people with many serious medical conditions are the most likely to experience lingering COVID-19 symptoms. But even young, otherwise healthy people can feel unwell for weeks to months after infection. The most common signs and symptoms that linger over time include fatigue, shortness of breath, cough, joint pain, and chest pain. The other long-term signs and symptoms may include muscle pain, headache, fast or pounding heartbeat, loss of smell or taste, memory problems, concentration or sleep problems, and rash or hair loss problem. Now, let's see some other problems in details. 1. Organ damage caused by COVID-19. Although COVID-19 is seen as a disease that primarily affects the lungs, it can damage many other organs as well. This organ damage may increase the risk of long-term health problems. Organs that may be affected by COVID-19 include A. Heart. Imaging tests taken months after recovery from COVID-19 have shown lasting damage to the heart muscle, even in people who experienced only mild COVID-19 symptoms. This may increase the risk of heart failure or other heart complications in the future. B. Lungs. The type of pneumonia often associated with COVID-19 can cause long-standing damage to the tiny air sacs in the lungs. The resulting scar tissue can lead to long-term breathing problems. C. Brain. Even in young people, COVID-19 can cause strokes, seizures and Guillain-Barré syndrome, a condition that causes temporary paralysis. COVID-19 may also increase the risk of developing Parkinson's disease and Alzheimer's disease. 2. Blood clots and blood vessel problems also caused by COVID-19. COVID-19 can make blood cells more likely to clump up and form clots. While large clots can cause heart attacks and strokes, much of the heart damage caused by COVID-19 is believed to stem from very small clots that block tiny blood vessels in the heart muscle. Other parts of the body affected by blood clots include the lungs, legs, liver and kidneys. COVID-19 can also weaken blood vessels and cause them to leak, which contributes to potentially long-lasting problems with the liver and kidneys. 3. Problems with mood and fatigue. People who have severe symptoms of COVID-19 often have to be treated in a hospital's intensive care unit, with mechanical assistance such as ventilators to breathe. Simply surviving this experience can make a person more likely to later develop post-traumatic stress syndrome, depression and anxiety. Because it's difficult to predict long-term outcomes from the new COVID-19 virus, scientists are looking at the long-term effects seen in related viruses, such as the virus that causes severe acute respiratory syndrome, SARS. Many people who have recovered from SARS have gone on to develop chronic fatigue syndrome, a complex disorder characterized by extreme fatigue that worsens with physical or mental activity, but doesn't improve with rest. The same may be true for people who have had COVID-19. There are many long-term COVID-19 effects still unknown. Much is still unknown about how COVID-19 will affect people over time. However, researchers recommend that doctors closely monitor people who have had COVID-19 to see how their organs are functioning after recovery. Many large medical centers are opening specialized clinics to provide care for people who have persistent symptoms or related illnesses after they recover from COVID-19. It's important to remember that most people who have COVID-19 recover quickly. But the potentially long-lasting problems from COVID-19 make it even more important to reduce the spread of the disease by following precautions such as wearing masks, avoiding crowds and keeping hands clean. Let's see some cases where post-COVID effect have seen. Case 1. In Kolkata, 2 practicing doctors died shortly after recovering from the infection. In Kolkata, 2 practicing doctors died shortly after recovering from COVID-19. Urologist Subrata Mitra, who was in his early 50s, died of a massive heart attack within days of rejoining work, while physician Dr. Aniket Neogi, in his late 30s, died in his sleep. The deaths of these 2 doctors has brought to light the fact that it is not uncommon for patients to succumb to COVID-19-induced conditions even after they have been cured of the infection and discharged from hospital. Case 2. Guillain-Barré syndrome following COVID-19. A newly emerging post-infectious complication. A 57-year-old man presented with a progressive flaccid symmetrical motor and sensory neuropathy following a 1-week history of cough and malaise. He was diagnosed with Guillain-Barré syndrome secondary to COVID-19 and started on intravenous immunoglobulin. He proceeded to have worsening respiratory function and needed intubation and mechanical ventilation. This is the first reported case of this rare neurological complication of COVID-19 in the UK. But it adds to a small but growing body of international evidence to suggest a significant association between these 2 conditions. Increasing appreciation of this by clinicians will ensure earlier diagnosis, monitoring and treatment of patients presenting with this. Case 3. COVID-linked syndrome in children is growing and cases are more severe. 15-year-old Braden Wilson was frightened of COVID-19. He was careful to wear masks and only left his house in Simi Valley, California, for things like orthodontist checkups and visits with his grandparents nearby. But somehow, the virus found Braden. It wreaked ruthless damage in the form of an inflammatory syndrome that, for unknown reasons, strikes some young people, usually several weeks after infection by the coronavirus. Doctors at Children's Hospital Los Angeles put the teenager on a ventilator and a heart-lung bypass machine. But they could not stop his major organs from failing. On Jan 5, they officially said he was brain dead. His mother, Amanda Wilson, recounted, sobbing, "My boy was gone." Case 4. Pus forms inside woman's entire body. The woman was hospitalized immediately and a team of doctors removed almost half a liter of pus from her body. Amid the cases of coronavirus infection, medical practitioners and doctors are faced with new issues. A woman complained of pain in her waist and back. On examination, doctors found her body filled with pus and antibodies to the COVID-19 infection were also found. The woman had got infected with the COVID-19 infection and had recovered. On November 28, she went to see a doctor. There was a swelling on her legs accompanied by excruciating pain. Such pain is usually the result of a fracture, tumor or infection. On detailed examination and an MRI, it was found that pus had accumulated in her body. She was hospitalized immediately and a team of doctors removed almost half a liter of pus from her body. The woman was discharged on December 21. You can find more about this in reference document provided in video description. I hope you enjoyed this video. Please like this video, share, you comment, and don't forget to subscribe my channel Random Knowledge Official.